Moving on to some health news, we're focusing on feet. Podiatrist Dr. David Campbell joining us to talk about why foot health is so important to people with diabetes. How you doing, Doc?
I'm doing well. Thank you very much. Sheldon, how are you?
I'm doing good. So our topic is diabetes in your feet. And I guess the first question is, why do I need to get my feet checked if I have diabetes?
Well, diabetics are prone to a lot of different pathologies, but one of the biggest reasons we focus on diabetic foot care is to reduce the risk of a diabetic going through an amputation, at least from a podiatric perspective. And roughly 73,000 amputations are performed each year on the lower extremity. And unfortunately, about 60% of those are related to diabetes.
Yeah, and when we talk about these, what type of problems are associated with your feet from diabetes?
So primarily, diabetics struggle from a few different perspectives. First and foremost, they are far more prone to developing circulation problems or peripheral vascular disease. They also struggle with a condition called neuropathy, which means the nerves in their feet that provide the protective sensations that tell your brain that there's a problem, they don't work properly. And this can lead to development of diabetic ulcers. And when the ulcers develop, because diabetics don't respond to infection as well, they have what we call an immunopathy, they're at a higher risk for bone infection. And that's typically what sets the stage for the amputation.
Well, what will the doctor do if I make an appointment along this line?
So we're going to do the same thing your primary care doctor will do. We'll get a past medical history, find out what medical problems you have in addition to the diabetes. We'll do a review of systems to make sure we're very aware of what you're dealing with presently. But most importantly, do a very thorough vascular exam, a very thorough neurological exam, and a musculoskeletal exam to look for any high-risk areas. And then we take all of those circumstances together and try to determine who's high, moderate, or low risk for problems in the future.
Okay. And if I do have diabetes, do I need to have special shoes or wear special shoes to help me out?
So a lot of patients that come in with diabetes because they have other health problems, they're not always good surgical candidates. So getting special shoes, special diabetic inserts, and most importantly, good hygiene, making sure your skin stays healthy with moisturizing creams because diabetics are prone to very dry skin. And then most importantly, adhering to routine examinations depending on which risk category you're in. It might be every 3 to 4 months, or it might be every 6 months, or even once a year if you don't have a lot of medical problems.
So I would assume if we stay and remain regularly checked, we can avoid some worse issues down the line?
Actually, you sure can. Over the last 10 years, we've had what's called a diabetic foot law within Medicare, which allows for diabetic shoes and protective inserts, and we have impacted the incidence of below-the-knee amputation tremendously through those efforts and just through the routine exams. So you definitely can avoid problems.
Hey, thank you so much, Dr. Campbell, for joining us today. Very important issue, and we appreciate your time.
Thank you, Sheldon. You have a blessed day.
All right, take care. Well, you know what?